Hello friends, myself Dr. Deepa Satish Mandlik welcome you all in the fourth part of urinary system. In this video, I'm going to tell you about composition of urine, renal function test and micturition reflex. At the end of the chapter, the learner will be able to study the composition of urine to understand different renal function test or RFT and to discuss the micturition reflex. So first of all, let's see the composition of urine. Generally, urine is yellow or umber color. Its specific gravity is 1.003 to 1.030, having acidic pH of 6, near about 1 to 2 liters of urine excreted per day. And about the odor, it is aromatic and becomes ammonia like on standing. Next, for the composition of the urine, I'm going to show you one diagram. So here the urine is collected into the container that shows two separate layer. One is yellow layer on which the red layer is there. So this yellow layer indicates the presence of water and the red layer indicates the presence of other substances. So you can see that it consisting of 96% of water, 2% of urea and 2% of rest of the substances. So in that 2% it includes uric acid, bicarbonate ions, creatinine, sodium, potassium, chloride ions and urea. Urine production is generally decreased during sleep condition and exercise condition. Now we are moving to the next part, that is the renal function test. Now, why there is a necessity of having renal function test? So if you found any one of the symptoms like high blood pressure, blood in the urination, frequent need to urinate, difficult beginning in urination or painful urination, and swelling of hands and feet due to accumulation of fluid in the body. So if you found any one of the reason, then there is a problem in the kidney. That time there is a need of having renal function test. So renal function tests are nothing but assessment of kidney functions that involves both evaluation of quantity and quality of urine and amount of waste substances present in the blood. So there are different kinds of renal function tests are present like urine analysis, blood test and renal plasma clearance. So let's see the first test, that is the urine analysis. So in this urine analysis, there is an analysis of urine is done. So analysis of urine is done means what? The examination of volume, physical and chemical as well as microscopic properties of urine has been done in urine analysis. So if you consider a normal urine, it having certain characteristics like it excrete or the person excrete near about 1 to 2 liters of urine per day. Its color is umber, yellow or umber due to presence of urocone pigment. The urine is transparent when it is freshly voided, but it becomes turbid on standing. Its odor is aromatic, but it becomes ammonia like on standing. And already its pH is acidic in between the range of 4.6 to 7. If you eat high proteinous diet, there is an increase in the acidity, and if you take vegetarian diet, it increase the alkalinity. And already the specific gravity also, it ranges from 1.001 to 1.035. Also in the urine certain substances are determined, like the presence of excessive albumin in the urine is called as albuminuria. The presence of glucose in the urine is called as glucosouria. The presence of red blood cells in the urine is called as hematuria. High levels of ketone bodies if present in the urine, it is called as ketonuria. And the presence of excessive bilirubin in the urine is called as bilirubinuria. Urobilinogen, the presence of urobilinogen in the urine, it's called as urobilinogenuria. This urobilinogen is the breakdown product of hemoglobin. And inside the urinary tract, number of bacteria resides that causes urinary tract infection. The most common bacteria is E. coli, the most common fungi is Candida albicans, and protozoa is Trichomonas vaginalis. So in the urine analysis, the volume, physical, chemical, and microscopic properties of urine are checked. Now, the next test is blood test. In that, two different tests are performed on the kidney, like blood urea nitrogen test, also called as BUN, and the plasma creatinine test. So, what is to be done in blood urea nitrogen test? This test measures the amount of blood nitrogen that is obtained from the conversion of urea into amino acids. When the glomerular filtration rate decreases, the BUN rises steeply. So there is an inverse relationship between the glomerular filtration rate and the blood urea nitrogen. The normal range of blood urea nitrogen is 5 to 20 mg per deciliter. Then the second blood test is plasma creatinine test. This test measures the amount of plasma creatinine that results from catabolism of creatinine phosphate in the skeletal muscle. And a creatinine level above 1.5 mg per deciliter is considered as an indicator of poor renal function. So these are the two blood tests that has to be performed on the kidney: blood urea nitrogen test and plasma creatinine test. Moving to the third test, that is the renal plasma clearance. So what is this renal plasma clearance? It is an evaluation of how effectively kidneys are removing a given substance from the blood plasma. If it is the volume of blood is cleared of a substance per unit of time. Usually it is expressed in ml per minute. High renal plasma clearance indicates efficient excretion of a substance in the urine, and low clearance indicates inefficient excretion. This renal plasma clearance is determined by one formula, that is S is equals to U into V divided by P, where U is the concentration of substance in urine, P is concentration of substance in plasma, and V is urine flow rate in ml per minute. So this is about the renal plasma clearance, in which the evaluation of the kidney functions are tested depending on the removal of given substance from the blood plasma. So I hope you have understood about three different types of kidney function test. Moving further to the last concept of this video, that is the micturition reflex. So first of all, let's understand what is micturition reflex. Micturition is also called as urination. So it is the process of expelling urine from the bladder. This act is also called as voiding of bladder. And this micturition reflex takes place in two different stages. First stage is resting or filling stage, and the second step is called as voiding stage. Generally, the function of urinary bladder is what? It acts as a temporary reservoir of urine. So when 300 to 400 ml of urine get accumulated inside the bladder become full, and the wall of the bladder contains stretch receptor in their wall. So that stretch receptor get activated in response to feeling of bladder, and that stretch receptor nerve endings send impulse to the spinal cord, and through the spinal cord the impulse then travel to the cerebral cortex of the cerebrum, where the proper analysis of information is taken place, and the nerve impulse is coming back here. The impulse is going to the urinary bladder, where it stimulate the contraction of detrusor muscle. That detrusor muscle is present into the wall of the urinary bladder, and this is the second nerve impulse that causes relaxation of internal urethral sphincter that opens the urethra. So once the internal urethral sphincter get relaxes, whatever the urine is present into the urinary bladder, that comes out of the urethra. So this is nothing but the micturition reflex. So I hope you understand the micturition reflex along with the help of diagram. Thank you.